Welcome back, everyone, to another episode of MI for Change. I am Dr. Monica Gilbert, and today we are going to speak about the roadmap of relationships or communication, however you want to call it, with clients. I'm going to be speaking about two combinations that I think make sense once you already understand what they are. So, if you're not familiar with OARS or with the four processes of motivational interviewing, I invite you to take a look or listen to my previous episodes on OARS and also the four processes of motivational interviewing. So, today we're going to be combining both of them. And a lot of the times I have questions of, well, now I know the OARS, I know how to use them, I've practiced them, I am comfortable using the OARS, but it just feels like I'm chatting with a client. Like this is like a never ending chat. We're not moving everywhere. We're not going anywhere. And that is why it's so important to combine both of these concepts, the ORs and also the four processes, so that you know how to use the ORs in each of these phases of your relationship or your communication with the client, because you are going to strategically use the ORs in different ways. Now you've already listened to previous episodes and you're more comfortable with all these concepts. So it should be a little easier. And this is going to put everything together in place and it's going to make perfect sense once we start getting into it. So I want you all to see the ORs as those tools. This evening or earlier today, I was putting together this closet for our garage. And I was helping my husband, or he was helping me, or I don't even think we were helping each other, honestly. We're very close to divorce because it was a very big closet and it was very difficult to follow the directions and just set it up, together. But, anyways, going back to the story or the metaphor that I'm trying to use is that the oars were the tools that we had in our toolbox. So the hammer, the measuring tape, the nails, all those things were the oars. And then the instructions with the map, those were the different processes of the motivational interviewing. So think about it as, first we have to go to the first phase, then the second, then the third, and then the fourth, but we're going to use our tools in different ways. When we are first building the closet, for example, and we start building the base, we're going to use the hammer just to make sure that the base is in place and all of the different, things that have to be there are stable enough to then build the rest of the things. When we move to the second phase of it, which is when we're trying to build the different compartments of that closet, then we're going to be using our tools in a different way. Okay. So the tools for your toolbox are the ORs, and then the roadmap are the processes of motivational interviewing. That's a nice little metaphor for you guys to use. And we didn't get a divorce where we did it. I think we just like ditched the roadmap and we went to YouTube, and that's what we used to build our closet. So why the ORs? And I'm going to give a quick refresher because I know that a lot of these acronyms we tend to forget. So O stands for open-ended questions, A for affirmations, R for reflections, and S for summarizations. And these are, again, the tools of motivational interviewing. Now, when we look at, and I always like to throw this, I guess, operationally define what each of these are and bring a more behavior analytical twist to it so that we can just see it in a different way. When we look at open ended questions, or when we hear open ended questions, I want you to think about them as discriminative stimulus, so SDs, that evoke verbal responses with multiple possible topographies rather than a yes or a no answer. So that's what open ended questions are. Now, when we look at affirmations, these are verbal responses functioning as generalized condition reinforcers that strengthen client statements reflecting effort, strength, and persistence. Remember, these are the things that we want to reflect. We want to shape these verbal operands. We want to shape this change that the client is speaking about. Then we have reflections, and R is for reflection, and reflections are paraphrase or rephrase statements that mirror the client's verbal behavior while slightly extending or shaping it. Then we have summarizations, and these are simply composite verbal behavior that tactfully aggregates and restates multiple prior client responses. So, this is a nice little way to combine behavioral analytical operational definition of these terms, so that you are able to see them in that way. Now, when we look at the four processes of motivational interviewing, they are engaging, focusing, evoking, and planning. These are the four processes of motivational interviewing. Let's start with the first one. The first one is engaging. And this is when we are building that foundation to our relationship with the client. I recall an instance where I started in the field, and this was the first time that I became a certified behavior analyst. And I went in there and I'm like, I'm going to do this parent training thing and I'm going to train them. And I have so much to offer. And I already had a script, I had everything already prepared, graphs and all. And I came into a session with a parent and I sat them down. I introduced myself, of course. So at least I was nice, right? I introduced myself. And then I started talking about all of these different interventions and the behaviors and all that. And I remember the parents just like wide eye just staring at me. Like, what is this woman speaking about? They were smiling and they were nice about it. But thinking back about that session, I'm like, they got nothing from that session. Absolutely nothing. This was the first time, by the way, that I was meeting these parents. So I'm not sure why I approached it like that, but I understand that I was young and I didn't really know about motivational interviewing. Hopefully, you can learn from that so you don't do the same thing. Because without engagement, we have nothing. When we first start working with our learners, when we start working with our clients, we don't just go in there and start using interventions. No, we have to pair ourselves as a reinforcer. We have to pair ourselves with the client. And the engagement part is not just the first phase, it is everlasting. You're always engaging, you're always working on this with the client. But foundationally, this should be the first thing that you work on. So, engagement is known as the high stage. And we've spoken about this in previous episodes of MI. Now, again, here we're building the trust and we're going to use the OARS, open-ended questions, affirmations, reflections, and summarizations in a different way. Here, we're going to use the OARS in order to facilitate that engagement. So the function of using the OARS in the engagement stage is to build rapport. So when we look at open-ended questions, we might say something like, what brings you here today? Or what has this experience been like so far? Here, we're not really fishing for answers. We are simply just showing genuine interest. Affirmation, something we can say is, you've really been trying to figure this out, even though it's been difficult for you. So, again, we are affirming the efforts. We don't want perfection. We just want the efforts to continue to go or even start. Reflections, you're not sure if anyone's really listened to you before. So this shows understanding. We are not judging. We are simply respecting, yeah, and also reflecting what the parent is already telling us or showing us. In summarization, we can say something like, so what I'm hearing is that you're tired of repeating the same patterns and just want things to feel calmer at home. Again, we are simply summarizing what the person is saying, what the parent is saying, so that they feel heard, so that they feel seen, and they continue to elaborate. They engage in that conversation with us. So, the mini takeaway in engagement when we are using the OARS is that don't focus on fixing, don't focus on coming up with solutions. Just focus on joining. You're joining the parent where they are, you're joining that client where they are. Okay. So now we're going to move to the second phase, and the second phase is called focusing. So, in focusing, we are working with clients to find a direction. So, again, I said with them because we want to keep that spirit of MI always with us. And we want to also make sure that it is a collaborative effort. And again, if you're just using the OARS and you don't have you're not following the processes of motivational interviewing, it's going to feel like you're just chatting, like you're not going anywhere. So the focusing stage is when you feel like you have already built enough rapport, you have trust, and now you can start sort of identifying or just honing down on what these interventions are. Like, what is it that they want to work on? What is it that the parent really wants to work on? And you want to work on that with them, on finding that out with them. So once engagement feels strong, we are going to start using the OARS to focus. So an open ended question might sound something like, of all the things we could talk about, what feels most important to you today? Or from 1 to 5, tell me some of the most important behaviors that you want to work on or that you want to tackle for your little one. So, again, this invites shared agenda setting, which is what we want. Affirmation, you've given a lot of thought to what matters for your family. Reflection, part of you wants to work on consistency with your child's routine, and another part worries it might not stick. I would just turn this around a little bit because we always want to end with the reflection towards change. So this reflection is good, but I would say something like, one part of you is worried that this intervention may not stick, and another part of you wants to work on consistency with your child's routine. Okay. You see how it's different when you ended with that, I guess, quote unquote, positive note or that conversation towards change. So that was a double sided reflection. And this acknowledges the ambivalence, but it also focuses on the part where the parent wants to be more consistent with their routine. So we can get a lot of more communication, a lot of change talk from this. Summarization. It sounds like your main focus today is finding ways to create calm evenings without feeling like you're constantly battling. So, the mini takeaway in focusing is that you aren't pushing here, you are guiding. Again, you're narrowing the lens with the client, not for them. So, we are not coming up with interventions for them, we are coming up with interventions with them, which is a big difference. Such a word can make such a difference, right? Okay, so once we have engaged, once we have focus, these are the interventions or the behaviors we want to work on. Now we're going to work or we're going to go towards evoking. And in this third phase, the evoking phase, this is where we're trying to find out the why. Sometimes it's the why, sometimes it's the what. This is actually my favorite processes in all of these processes because I feel like this is when we're actually using these words in order to get more of this change talk, and we're evoking the reasons for change from the clients. So they're not our reasons for change, they're not our values. We're focusing on their values. We're focusing on their reasons for changing. Why do you want to change right now? Why is this important? From 1 to 10, pull out your ruler and start doing, the ruler method with them. Okay, so let's look at how we will be using the OARS during this evoking stage. An open ended question might sound like, what would be different if things started to improve? Hmm. Maybe the parent might respond with, well, if things started to improve, I could definitely go eat at my favorite restaurant, or maybe we could take that road trip to Disney World because they won't be having all these behaviors in the cart. Another open-ended question, when have you handled this better in the past? Hmm. So this is also, I like this question because it invites affirmations. So once the client tells you, well, in the past, I've been able to use this and I've been very consistent with this, you can use an affirmation to strengthen those things that have helped the parent be consistent with the intervention. This again reflects reflection and invites a sense of hope. Affirmation, you've managed really tough situations before. You're super resilient. This again strengthens that self efficacy. And we all know that this is a key to the MI concept. Without this, we really don't have motivation. We really don't have change. We have nothing. A reflection may sound like you really want to be patient. Sometimes frustration takes over. And perhaps I would say something again like frustration tends to take over, and you have also found certain skills that have allowed you to be patient in those moments. So this is an affirmation and a reflection at the same time. Um, Something else that we may say, and again, we're using reflections here in order to evoke. We want parents to come up with their own strategies. So that works really well with that. And then you can follow up with an open-ended question. I wonder how you would use those same techniques during your child's tantrum or during your child's maladaptive behaviors. So, again, we can use a combination of different things. With reflection, we are deepening awareness and gently amplifying desire and ability for change. So, we're tapping into that darn cat. Another reflection that we can use is you're starting to see that even small shifts in your routine could help everyone feel calmer. Just drop it there and see what the parent might respond to that. Perhaps they say something like, yeah, I've noticed that some of these changes have really alleviated a lot of the chaos at home. And then I would further reflect and say, yeah, it seems like these strategies are really working for you. I wonder how you may use these strategies. How else can you use these strategies? Or what are other strategies that can alleviate the chaos at home even further? Again, we're evoking it from them. Even if I have some ideas of things that can help, I'm going to keep those ideas to myself. I'm going to allow the parent to give me everything that they have. And then summary would sound like, so far I've heard that being more consistent could reduce stress for you and your child. And you're already thinking about how to start. So summaries here collect and highlight change talk, almost like holding a mirror up to motivation. So that's exactly how we want to use these OARS during this phase. And the main takeaway for this evoking stage is that you want to listen for the darn cat. You want to listen for the desires, for the reasons, for the needs, and you want to accentuate those and reflect it back so it grows louder than the sustained talk. Some people think that, or they've asked me, what happens if the parent or the client engages in an instance of sustained talk during the session? And I said, well, that's definitely going to happen. You're always going to have instances of sustained talk. It's natural. It's normal. What we want is for the change talk to be louder or to be a higher magnitude or higher frequency than the sustained talk. That's what we want to achieve during our sessions. Okay, so this last phase is the planning phase. And this is when we are moving from the why to the how. So, this is how we do this. And oh my gosh, I just kind of mentioned the lyrics of a song, right? This is how we do it. Anyways, um, all right. So, once we have engaged, once we have focus, once we are getting the hang of evoking some of this change talk from the parent or from the client you're working with. Now we have to think about a plan. Let's come up with a plan together and collaborate with it. So, how we would use an open ended question would be something like, what ideas do you already have about the next step? What the next step might look like. Let me restate that because I stumbled a little bit. What ideas do you already have about what the next step might look like? So, what ideas? Keep ownership in their hands. Affirmations. You've really thought it through. You're not rushing into it. You've had a lot of time to think about it and you already have a plan together. Reflection. You feel ready, but still want to make sure you can keep it realistic. How might I help in this process? And that was a reflection with an open ended question. You want to normalize cautious but optimistic behavior here. And then a summary, you want to start by trying one structured activity after school. and check in next week to see how it feels. In the planning phase, I think this is when we use our summarizations the most, or where our summarizations have the most impact. Because here is where we are speaking about the plan, we're tying it all together, and then we are restating it or summarizing it back to that parent. So here is where you will see the summary part accentuated, because again, it just makes sense that we would use it that way. A mini takeaway in summarization is that planning in MI isn't only about prescriptive use. So it's about collaboration, action with accountability that still feels empowering to that client. So we want to collaborate with them. And of course, we are also going to share what our thoughts are and perhaps talk about some interventions that we've tried in the past. And, I think that people sometimes think that motivational interviewing is one sided, where the MI person has no idea. The MI therapist has like no idea. They're never sharing anything. It's not like that at all. We're there to share. Let's evoke first. Let's have the parent or that client come up with something. And then we can also share some ideas. So you can say something like, is it okay if I share some of the ideas that have worked before? Um, and that's an AOA approach, right? That we've learned about. So, can I share some of these ideas, or if they're a little stuck, how about we look at this? So, you can definitely also come in and share some of your thoughts and guide them, because sometimes when we work with clients or with parents, they're lost, they don't know where to start. So we can help them and guide them through that road, so it they don't feel as overwhelmed and as lost. So to recap, OARS is your toolkit, and the four processes of motivational interviewing are your roadmap. So think about it that way. And again, in later episodes, I'm going to talk about how to soft and sustain talk, which I think also helps with evoking and helps in these other phases. But what I want you to take from this episode is that the ORs are tools that are very important to use. But again, it's important to use your heart, but also your brain. The ORs are your heart. And now, when you think about it strategically on how to move the client forward, then you're going to think more about how to integrate the ORs into these phases. An interesting story also this weekend, now that I'm thinking about it, was I went to a friend's house, and we were all there speaking about different topics. And then someone brings up and says, well, I don't believe in therapy because I was going to a therapist for a year and it was just not working. Like, I wasn't going anywhere. I mean, I loved going there, chatting with the therapist, but nothing was getting done. It was just a lot of empathy, and I was able to talk about the things, but she never really held me accountable for anything. And this person stopped going to therapy and now is refusing to go back to therapy, even though they're going through many challenges because of that experience. And I invited her to reach out to another therapist that may have more experience. Um, I think, and perhaps this is just my biased opinion, but this is my opinion, that in therapy, you want to go in there with empathy. You want to go in there with this safe environment so the client is able to speak and communicate. But if you're not helping to move them along, then you may not be doing therapy. You may not be like really doing this coaching approach. And I think that that is really important. Clients come to us because they want to see a change. Sometimes they come to us just because they need someone to talk to, and that's okay. We can be that person. But usually those people like don't last, I think, so long. And you'll see that the client just wants to chat. But a lot of the clients, I feel, come to us because they want to see a change in their lives and they're in this ambivalent stage. So it is our responsibility as clinicians to help move them along. And if you feel like you're stuck, you may have to go back to that engagement phase and make sure you're not skipping around, and that you are going through each of these processes and you're giving it enough time. Another question that I sometimes get is, how long do we stay in this engagement phase? And the reality is that I have no idea. It can be a day, it can be an hour, it can be a week, it can be a month, maybe a year, hopefully not a year, but it depends. It depends on the client, it depends on your personality, it depends on so many different factors. But it's important that you first make sure that you have that foundational skill, because if not, we're building closets without basis to them. And you know what happens when they don't have a basis, everything falls through it. So I invite you to engage with empathy, to focus with collaboration, to evoke with that sense of curiosity, and to plan with partnership. I hope that you found value in this session and that now you're using your OARS and the four processes of motivational interviewing in a different way. So let me know what you thought about this episode. Let me know what has been the most difficult for you. And a final reflection is, before your next session, if you're sitting in the car about to go into the home of your client, or if you're waiting in the waiting room to see your client come in through the door, think about this, or try asking yourself before you see the client: which process am I in right now? So, what process is your client in right now, actually? Which or skills would be best to use in this process? And how am I going to use the ors if my client is in this process? So, I'll see you guys next time. I hope you enjoyed this. Please share your comments and share with everyone else. Thank you for joining me on today's episode of MI for Change. If you're ready to keep growing your motivational interviewing skills, I'd love to invite you to explore my MI Academy, where you'll find a full library of on-demand courses designed to help you put MI into practice with confidence. You can learn more at www.drmonicagilbert.com. Until next time, keep asking the questions that spark change.